Hello, I'm Christopher Sweeney, a medical oncologist based in Adelaide, South Australia, Australia, and I'm a director of the South Australian Immunogenomics Cancer Institute at the University of Adelaide. So the DASL-HiCAP study is to see if we can intensify systemic therapy in patients with very high-risk prostate cancer. DASL actually stands for darolutamide augmenting systemic therapy for localized high-risk prostate cancer. And patients presenting with high-risk prostate cancer are of two major categories: those who are treated with primary radiation therapy, so this is 2 years of testosterone suppression with radiation, with or without darolutamide in the primary radiation setting, or patients who've had a prostatectomy and have very high-risk features with high Gleason score, PSA rising immediately after the surgery, or within a year of surgery. So it's patients we anticipate would have a metastasis-free survival of about 75% at 5 years. And we're hoping that we can decrease that recurrence with bad disease with augmenting the hormonal therapy with darolutamide for 2 years. There are different disease states in prostate cancer. So these are patients who are potentially cured with salvage radiation therapy in the post-prostatectomy setting. So there's the EMBARK study where patients have had salvage radiation or relapsed after primary radiation and their PSA is going up, and they get randomized to enzalutamide with testosterone suppression, enzalutamide alone, or testosterone suppression alone. This is different because it's a rising PSA that could be due to local recurrence, and these are patients who could be potentially cured with radiation to the prostate bed and the nodes. So unlike EMBARK, we think we can cure some patients in this setting. There was a study that was presented yesterday, Formula 5 where they showed 6 months of testosterone suppression with apalutamide and abiraterone had a much better metastasis-free survival in a smallish study in patients who had a PSA greater than 0.5 and very high risk. And so this is 2 years of therapy. So it's showing that there are patients who do relapse immediately after surgery in this post-prostatectomy cohort who we can possibly cure with augmenting the systemic therapy. And the Formula 509 with 6 months of therapy, and they see a benefit. We're giving 2 years of therapy, and hopefully we'll see even a greater benefit. The RADICAL study looked at 2 years of testosterone suppression against 6 months and showed patients post-prostatectomy seemed to do better if they had high-risk features. Here we're trying to see if we can do even better than that in terms of the metastasis-free survival endpoint. So again, most patients who present with high-risk features would be eligible for this study. Darolutamide is fairly well tolerated, and so it's standard of care hormones for 2 years with radiation with or without darolutamide for high-risk disease, or go to surgery and still have high-risk disease, potentially salvaging them with the same regimen, just different radiation approach. So we have accrued about 80% of the patients out of 1,100, and so the endpoint is basically metastasis-free survival. So it could probably be about another 5 years before we get results. But if the control arm does poorly because they just got testosterone suppression alone, it may read out sooner. So it depends on how many patients relapse. And the endpoint is still conventional scan metastasis-free survival, which we can capture either by disease seen on the CAT scan of a PET scan, or a bone scan, or a standard CT scan.